Hello there. Thank you for joining me for this Lunch and Learn on intellectual dishonesty and COVID-19. So I've got a few stories I want to talk to you about. And my heart is very, very sad today because our country has been very, very hurt by this pandemic. And a lot of people will say that this is not a real thing. I'm not saying it's not a real thing. It is a real thing. There is a real virus. There is really something going on, but our government is not being honest with us. Now, I don't know if you heard our governor. I'm in the state of Texas. I don't know if you heard our governor who talked yesterday and the plans for reopening. And what he did do was increase the amount of capacity that a restaurant can have from 50% to 75%, which is great, but that still means that the restaurants are 25% closed, which is not good. The bars are not open at all, and I don't frequent bars, so it really has nothing to do with me personally, but I do know people who own bars, small businesses. We are a small business. This community that I live in is a very small community, so when one of us hurts, all of us hurt, okay? And so, unfortunately, the governor still is not releasing the numbers, releasing the bars to reopen, which is quite upsetting because it's dealing with people's livelihood. Now, I don't know if you know, but yesterday there was this big kerfuffle with Nashville, Tennessee, and the mayor's office is not releasing numbers, and they got found out. And so this is the news report. I've got it up on my computer so I can just kind of reference that with you. But one of the things that our governor in the state of Texas says is that we can't reopen the bars because there would be too much contagion because people won't social distance, blah, 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 blah. Well, the statistics for Nashville, now I don't know if you've ever been to Nashville, but Nashville's quite a social place, okay? And so what they found in Nashville as of June the 30th, so that was February, March, April, May, June, okay, coronavirus for all that time, they found that with bars and restaurants, just 22 cases, okay? Just 22 cases. So that means that bars and restaurants are not a place where you're going to get COVID-19. And yet, the story is not that there's only 22 cases in Nashville. The story is that they did not publish these numbers. They circulated these numbers through the officials, and it was labeled not for public consumption, meaning you can't put it out there. And so they asked if it was going to be publicly released, and they say, no, it's just for the mayor's office. It's correct, not for public consumption, okay? So a month later, the health department was asked point blank about the rumor that there was only those many cases in the restaurants, and they wouldn't answer the question. So this is intellectual dishonesty. I just call it liar, liar, pants on fire. I mean, I'm just going to say that. We do not want our government officials to do that. Now, I'm going to talk to you about in our own state, in our own county. We live in Harris County, Texas, and we have been at code red for several months. Now, I work in the healthcare industry, and I have not seen but one person that has come into my office that had COVID, recovered from it, got the test, that they were clean and all that. So I've only just seen one person, and we've been open every day that we were supposed to be open all this year. So we're not seeing a flood of people. We're not seeing a whole bunch of people that are testing positive and that are dying. We're just not seeing that. We do know people that have died. Every death is tragic. We're not minimizing that. But our county is still at code red. And I'm going to post a video in the comments here. And so normally this is a live organic video on Facebook Live. It does get posted to BitChute. It does get posted to YouTube, okay? So if you're watching it on YouTube or BitChute, then you're probably not going to get the comments. So we do have people come back and say, please put the links. Well, you know what, I can only do so much. So if I'm saying I'm going to put a link in, it's going to be on the Facebook post. Go back to my Facebook page, Abundant Health and Wellness, and download that link. But I am going to put a video. I'm going to tell you some statistics. I'm going to put the video so you hear it from the horse's mouth, okay, because I was scribbling furiously. I may have made a mistake. I didn't try to make a mistake, but anyway, the comments will have the actual video. It's probably an 8-minute video. It's not a big deal. But these are some statistics that came out with our local independent school board meeting, that they crunched the statistics and they found out that our county is not being honest with us. Now, anybody that has any critical thinking skills probably knew this, but we've got it down in writing, okay? Well, it's on our audio, so there you go. What we're seeing here in the Houston area, the Harris County area, is that our public officials are saying, test, 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 test. We've got all these testing places open. It's free to you. Go and do these tests. And then based on the number of positives, and we're going to know when we can lower the threat level and when we can get back to business as normal. That's the whole point of this, okay? We still are not at back to business as normal. So, in our state, the state of Texas, okay, Lone Star State, I love my state, but we had some problems with a backlog of cases, okay? As of August the 1st, 2020, the state updated its software package where they were able to download, get everybody caught up with this backlog, okay? So the backlog of tests were then filtered down to the local municipalities. So it would be the Harris County, Bexar County, Dallas County, wherever you are in Texas, okay? Everything got flushed through the pipeline, okay, in August, okay? The counties were supposed to weed out the duplicates. Now, I'm just talking about Harris County, what Harris County did, but all the counties in the state were supposed to weed out the duplicates. They were supposed to categorize them in the order that they came in, and they were supposed to give you an up-to-date, this is what's happening right now. Okay, from August the 1st through the 31st, Harris County recorded all of the cases when the county received the cases, not when the cases were determined. So there was a backlog, months of backlog. They all got pushed through the pipeline in August, and through August 31st, they categorized everything as coming down that day. Whatever day they got it, whatever day they processed it, they counted those cases as of that day, okay? On September the 2nd this year, there was an email that went out to the school district from Judge Hidalgo, and she said that the 14-day average was 973 new cases per day. Therefore, the threat level had to be at red. On September the 4th, 2 days later, a tweet from both Hidalgo and Turner, that's our mayor, stated that there were 1,015 new cases, so the threat level had to stay at red, okay? Now, the judge had said when the new cases come down to 200 or 400 new cases over a 14-day average, she would be able to move the threat level from red to a lower level, okay? So the number that she was looking for was 200 to 400 new cases over a 14-day average, okay? So when this school board member, I'm going to put this in the comments so you can actually see and hear what she said. When she crunched the numbers, and she's a number junkie, she said that. She loves data and she loves to take care of this kind of thing. When she crunched the numbers, she knew that something was not right. She said of those 1,015 cases, 758 were over 30 days old. Okay, so that's really important. The actual new cases were 272 over a 14-day period. Okay, 272 over a 14-day period. Remember, the judge said if it was 200 to 400, she would remove the red threat level. It was 272, which is well within that that band frame, okay, this translates less than 6 new cases per 100,000 people. Now that's a big deal. Less than 6 new cases per 100,000 people per day, okay? So she said that the actual cases continue to decrease daily. So we are well within that number that we need for the county to go back to normal, but they're not telling us that. They're lying to us. They are not telling us. And so we as citizens, okay, we need to be able to go to our judge. I know there's a big thing tomorrow outside of City Hall, outside of where the judge's office is. And so people are getting up in arms about this, and there's a reason for that, and I'm glad they are, because we are being lied to. Let me tell you something else that's happening that's not a good thing. My husband gets all these kind of great things, and so he sent this, and this was on MSN News, okay? MSN said this. There was a lady, and she's been in the news, so this is not anything, and it's in print anyway, so I'm just going to read this and talk to you about this. It says, when Lisa Robertson sought coronavirus testing for her college athlete daughter, a pediatrician recommended a small independent pharmacy in Arlington, Virginia. Preston's Pharmacy charged $35 to take a nasal swab specimen and send it off to the lab, Principal Diagnostics, for quick results. The lab billed her insurance company $864, more than 8 times what the Federal Centers for Medicare and Medicaid Service reimbursed for COVID-19 tests. So remember, the patient was charged $35. The insurance billed $864, 8 times more, okay? The mom says she was absolutely floored when she got the bill for her insurance company. The daughter learned later, days later, that she was negative. She was able to go back to her college, okay? She actually is an athlete. She competes on the soccer team at Rice University. Where's Rice University? Right here in Harris County in Houston, Texas, okay? So Robertson, her mom, was surprised that her insurer, Blue Cross Blue Shield, okay, which has robust benefits for federal employees and retirees, they paid the full amount. Okay, so she got the check for $864. She signed the check over to the insurance company, and the insurance company paid the lab. The lab is in Bethlehem, Pennsylvania. That's where the lab is based. Okay, so why would it cost $864 and then our insurance paid the full amount? Is the lab taking advantage of a situation and not being regulated? What are we talking about today? We're talking about intellectual dishonesty, right? So that's what we're talking about. It's a question that more and more are raising, with 85 million tests administered so far and a congressional mandate that requires insurers pay the full cost of testing no matter how much hospitals or the labs choose to bill. As routine testing expands in the workplace, universities, and professional sports leagues, labs may have found a lucrative niche amid the pandemic. Now, I have not been tested. I'm not going to be tested. Why am I not going to be tested? Number one, I don't want to be in anybody's database. And number two, I'm not sick. I don't have any symptoms. And so there's no reason. When have we ever gone to the doctor and said, gee, I think I might have leukemia. Go ahead and test me. Gee, I think I may have COPD. Go ahead and test me. No, we go to the doctor when we have a symptom. The doctor runs whatever tests are necessary, and the symptoms decide what we have, okay? And so I don't understand this push to go and test perfectly healthy people, and why perfectly healthy people are going to be tested, but we've had 85 million tests as of the date of this this paper right here. And I got this paper this week, so I think it's a very recent paper. All right. Aaron Fuse Brown, a Georgia State University College of Law associate law professor who has researched medical billing, says that the key factor is that federal legislation requires insurers pay the full cost of COVID testing, but does not limit the amount of labs and labs and hospitals can charge. It's not surprising, this is a direct quote, it's not surprising that the lab tests are all over the map. This requirement can create incentives for labs who are out of network to stay out of network and charge higher prices for COVID tests because insurers are required to pay for them, okay? In July, the House Energy and Commerce Committee sent inquiries to 10 laboratories and hospitals about COVID test prices that reportedly ranged from $300 to $6,000 a test. That's a pretty big range there, $300 to $6,000. Now, we know that when the government, and all of the governments did this, everybody in March shut down for 14 days to flatten the curve. Everybody did, okay? After that 14 days, things were extended. The hospitals, certainly in Harris County, in my area, we would drive by the hospitals and the parking lots would be absolutely empty, okay? We have read, and you have read stories of hospitals who furloughed their people. They didn't have enough business coming in to have full shifts, and so nurses and doctors were furloughed, okay? Why is that? Because the governments told the hospitals you cannot do any elective procedures, and so all you can do is have people on hand to handle this horrible, horrible pandemic because we're going to be overrun by COVID positive patients, right? That's what was told. The hospitals cleared everything, had all the beds available for COVID people. It did not manifest in most cases. Yes, you had hot spots. Yes, you had problems, but most of the time that was not a big deal. So what has happened to their cash flow? Well, the hospital's cash flow, there's a big hospital in the Dallas area. I want to say Baylor White, but that might not be right. Okay, so y'all don't shoot me. I don't remember the name, but it's a big, big hospital. They've had to close down because they lost so much money during the pandemic because no elective procedures were done. Insurance is a for-profit business. You pay your premium. They, do what they do, but they are for profit. Whenever you go into the hospital, they always check what your insurance will pay. If your insurance will pay, you have the procedure. If your insurance won't pay, then you got to find the money elsewhere. So most people don't have procedures that the insurance won't pay for. So all through this time, right, the insurance have not been getting those payments for medical procedures. So they've been losing money. You got to follow the money trail, okay? So remember, when they tested or they sent out these inquiries, the test $300 to $6,000. The committee's letters described the charges as unconscionable and clearly excessive and questioned whether the labs complied with the Families First or the CARES Acts, both intended to ensure widespread testing with little or no cost to the patients. A doctor who worked for a chain of freestanding emergency rooms in Texas went to an Austin location to get a COVID-19 antibody test. His insurance plan was billed $10,984 for the test, and the insurance company paid the entire amount, prompting the doctor to quit the chain. $10,000 for a test. ProPublica reported this, and under federal legislation, the insurance companies must cover COVID-19 testing at no cost to the patient. The legislation also requires providers post on a website the prices for COVID testing, but the Energy and Commerce Committee noted that some labs failed to meet this requirement. Okay? Now, when have you ever had the opportunity to go to the hospital. I'm coughing. I don't know what's going on with me. I need to go get tested. Oh, sure. Insurance will pay for it. No cost to you. When has that ever happened? Never. So what is the motivation behind the government, behind the insurance companies? What is the motivation that everybody, symptomatic or not, can go down and get this test at zero cost? What is the motivation there? Okay. The lack of a federal plan leads to coronavirus testing delays. A separate analysis by a nonprofit and nonpartisan Kaiser Family Foundation found nearly 1 in 4 hospital websites did not publicly post the prices. Of the hospitals that did, Kaiser found some prices as high as $850 for a single test, not including the extra fees that a consumer might be assessed, such as the cost of a doctor's visit, okay? The facility fee or specimen collection. The median price was $127, but about 1 in 5 hospitals charged more than $200 per diagnostic test. The survey conducted by the industry group America's Health Insurance Plans found hospitals or labs that did not contract with insurance plans tended to charge the most. Oh, surprise, surprise, okay? About 1 in 10 of these out-of-network providers charged an average of $390 per COVID test, okay? By comparison, Medicare, the government insurance program for older Americans, I'm not quite there yet, okay? I'm not quite there, pays the lab $100 for each COVID test processed by high throughput machines. That's a quote, high throughput machines designed to increase capacity and deliver faster results. For other COVID tests run on different instruments, Medicare paid about $51 per test as of April. Here's a quote. It does show that there is price gouging occurring during this pandemic that we feel is not appropriate. This is by a senior vice president of product, employer, and commercial policies, okay? Thornton and others explained when such excessive prices are billed, it ultimately costs who? Who does it cost? Employers, consumers, and taxpayers more because insurers raise the premiums to keep pace with rising costs. So again, we have intellectual dishonesty, right? Now, I don't make government policy and nobody listens to me, so I'm not expecting to, have any influence out there. But I am expecting to be able to give you some information. And if all of us will talk to our insurance companies now, that leaves me out because guess what? I don't do insurance. Why is that? Because I'm holistic and insurance does not pay for holistic. So just going to throw that out there. If you have an insurance policy, if you are paying premiums, then you need to be raising a ruckus because the insurance companies are price gouging during a pandemic. Now, we live in the South. We live in the South Gulf Coast. We have hurricanes all the time, every year. It is illegal for our gas stations, our convenience stores, our big box stores, or whatever, to price gouge during a natural disaster. Why would it be any different during a pandemic? People need to be up in arms. People need to be pounding on governors and mayors and county judges' doors saying, look, you guys are not being honest with us. We've got this information. We're hearing this, we're reading this. And there's all kinds of things that are out there that are documented that you need to look at, you need to download, you need to go and fight, because otherwise we're going to have these problems. If I had insurance, okay, I definitely would not like the price to go up. And in a few years, I will be Medicare age, okay? We want those premiums to be low because why? We've already paid in the money. And that was the promise that when we got to be old and decrepit, we would have insurance. Okay, and I'm just making light of that. I'm not planning on getting decrepit. I'm planning on getting older. But we don't want to have price gouging to raise the prices of any kind of insurance company. Your private insurance, your Blue Cross, your Blue Shield. I've got family members that have that. I've got family members that have other insurance, as well as Medicare and that kind of thing. And so we need to make sure that all of this is taken care of. This is another quote. We wanted to get to the bottom of what these tests would be costing the health systems as a whole. All of the healthcare costs are reflected in premiums for health insurance, okay? It says, for Robertson of McLean, Virginia, the direct cost of COVID testing has not ultimately harmed her family's finances. Why is that? Because her insurance company paid the whole $864. Her insurer sent her a check down to the penny for the amount the lab charged. Even though she thought the charges were excessive, she forwarded the check to the lab. Her main concern is the pricey testing charged to consumers and insurers will ultimately lead to higher health care costs. Okay, so I want to just continue talking about intellectual dishonesty, and I have statistics here. This is as of August the 26th, not quite a month out, okay? The U.S. COVID death rate was 183,270. Now, I know we're almost a month out, so I know that number's not quite current, but it's less than a month out. It was the last time I crunched the numbers, so I'm being honest with you, okay? That same week that number came out, 183,270, let me say that again, 183,270. The CDC came out with, oops, we made a mistake. The people that actually died from the virus was 9,000 something. Okay, I don't know if you remember that. It didn't get a whole lot of air time. They said that the 9,000 people, actually COVID-19 was the cause of death. The other people, the cause of death was heart attack, COPD, diabetes, car wreck, whatever, but they also had COVID-19. So that was the discrepancy in those numbers. But again, it is not intellectually honest for the CDC to be posting these numbers, because then everybody, gets their knickers in a twist because they think the sky is falling, and the sky is not falling. Here, I think the school board meeting was 2 weeks ago, so it was after September. Okay, we're September what day? The 17th, 18th today. So 2 weeks ago, the new case rate was less than 6 per 100,000 people tested. That is a very, very low infection rate, people. We need to open up the country. We need to open up the county. When we drive on the streets of Houston, they've got those digital billboards that the government puts up, there's an accident here, the road closed here, and these signs are saying, stay home, stay safe, code red. We don't need to be in code red with less than 400 new cases on an average of 14 days. Remember, it was 200 and something cases, right? And if you extrapolated that data, it's less than 6 people per 100,000 people tested. Those are the numbers. So do what you can, influence your neighbor, influence your school board, influence your county judge. Do what you can, because my heart is breaking for all of the small businesses that are being hurt by this, okay? We have been affected. Our small clinic has been affected. Why? Because people are reading code red, people are hearing stay home, stay safe, and people are afraid to get out. We're going to make it. By the grace of God, we're going to make it. But there are other businesses in our community that are not, and my heart breaks for that. We are being lied to. We need to be honest. We need to make our elected officials accountable. And we need to say, enough of the BS. We and apparently you can look at these numbers. The video will tell you more about that. So I'm going to post that video. Let me know what you think, and share. Thank you for all of you who have shared in the past. I appreciate that. And I do know that even last week, people sent our video to the governor. I don't know that he ever watches it, and I'm not saying do that. I'm just saying people did. Thank you very much for getting the word out, because we need to have our state open. Jobs depend on it. Families depend on it. Marriages depend on it. Mental health depends on it. And, we need to have intellectual honesty during this terrible pandemic. So it is the weekend. Again, we always do this on Friday. It's the weekend. Love you guys so much. Be good to yourself. Self-care. Get the word out. Thank you so much. Love you. Bye. See you next week.